When building medical products, the very first points to consider is to identify a medical problem you wish to solve. These medical products have to be built by science, and the way you build things by science is you have to use the scientific method. The second point to consider is how urgent is your medical product. Urgency is a great driving force for disruptive technologies. Let's take the most current and urgent problem facing the world today, the COVID-19 pandemic. So you want to come up with medical products that in fact can change the course of the disease. So let's see, the objective to contain the COVID epidemic. So from the objective, you formulate a hypothesis on how to solve the problem, how to contain COVID epidemics. The next step in the scientific method is to ask the question, what do we already know about this problem? Are there any other examples of urgency where you had a worldwide epidemic? And in fact, we do have such an example.
In June of 1981, a small article appeared in the San Francisco Chronicle.
A mysterious outbreak of a sometimes fatal pneumonia among gay men has occurred in San Francisco and several...
It was only the first sign of things to come.
AIDS is now spreading in epidemic proportions to other segments of the population.
So we're describing now the emergence of an acquired immune deficiency syndrome, AIDS as it's commonly known. And AIDS in the early 80s was fear and panic everywhere because we didn't know how it was spreading. We saw it in the blood supply. We saw it in certain high-risk populations that had unprotected sex or would share needles. So until that moment that researchers discovered that it was one virus that was a common denominator of all these various syndromes, that a medical breakthrough happened. It's this point now where you need to consult with key opinion leaders. I'm having lunch with Professor Montagnier, probably the most important virologist in the world, front and center, the person who first described the isolation of the AIDS virus. And then I brought up the subject that I had just heard of in the morning. I said, Professor Montagnier, did you hear that there's a viral load test just got approved by the FDA? And I said, we've been blind in the way we've been trying to treat, cure, whatever we can do from people who are suffering from AIDS. And if we now have a test that you take a blood sample and you can now count up how many virus particles there are in the blood, isn't this the turning point in the fight against AIDS? He didn't even have to think about it. Just put down his iced tea and said, absolutely. Because now when you give somebody a drug, you can measure. And if the virus particles are the same or more, it's not working. And if it's less, it is working. So we left the era of increasing very toxic drugs, thinking that more drug would kill virus, and it didn't, to now making the medical and pharmaceutical community realize that they had to come at the virus several different ways. They needed a drug for one part of one protein, another drug for a different protein, and started doing combination chemotherapy. And guess what? Nobody dies unnecessarily of AIDS anymore because that was a brilliant approach.
The scene evoked memories of the 60s, angry demonstrators engaging in civil disobedience, hundreds of helmeted police, both sides well organized, playing out their roles in a kind of political ballet.
To summarize, first came the diagnostics to define the scope of the disease, then the medications to stop individuals from dying of the disease. But we still have an AIDS epidemic. Why? Because the scientific method was abandoned. The constant promises of an HIV vaccine never materialized. But instead of changing the hypothesis, the medical field continues to this day to repeat the discredited HIV vaccine over and over again, expecting a different result. Einstein called this approach insanity. So the original protests of the HIV/AIDS and the emergence of things like ACT UP and the like got the attention of everybody. They knew exactly how to push that button, and they had a plan to make sure that people got involved. However, only a handful of scientists knew that more efforts should have been focused on studying the natural immunity to HIV. Unfortunately, that approach met with violent opposition. So here we are again facing another epidemic. Again, the pharmaceutical industry has come up with a medication, a vaccine, that can stop individuals from dying of the disease. But again, a vaccine is not containing the epidemic, since vaccinated people can still harbor lots of virus in their body. Entrepreneurs need to embrace the new business paradigm that if you want to solve a problem properly, you have to be the key opinion leader introducing your disruptive technologies derived from the scientific method. The misstep in containing COVID was that medical authorities did not conduct a proper review of the literature after the hypothesis was formulated. There were no good examples of containing the AIDS epidemic because there were not models of containing retroviruses, the virus that HIV is. This is not the case for COVID, which is a coronavirus. There are over a dozen successful vaccines against animal coronaviruses that are targeted at the surfaces of our bodies, known as the mucosa. It is now time to change the hypothesis to include vaccines with a mucosal component and devices to measure their success. Entrepreneurs must rise to this occasion to build the disruptive technology that healthcare workers will need. It's time to get busy. Why stop? And I believe that it's not only a privilege to know, it's not only a duty to act, but it's also a duty to carry on.